There is no health without mental health. There is no health without mental health.
Hundreds of Vermonters gathered at the State House on Wednesday to protest some of the budget cuts proposed by Governor Peter Shumlin. Over the last 3 years, the state has cut money for services for the developmentally disabled and the mentally ill. Now Governor Shumlin is proposing to cut millions more. We interviewed several people who came to the Montpelier rally.
I come at this at so many different angles because it affects not only me, it affects my husband, it affects my son who has autism, so it affects him on the developmental disability level. We've taken such huge cuts over the past 2 years, $15 million. This is another $11 million cut. You cannot cut meat from a bare bones budget, and that's what we're operating on, where I am waiting for a case manager. My son, if he loses some of his services, will lose his ability to remain independent. With autism at the age of 27, he lives in his own apartment. Any of his services that go, he won't be able to do that anymore.
Governor Shumlin, he platformed when he ran for governor that he would not have any cuts, and his budget right now calls for $11 million, and that's unacceptable. These folks can't take it anymore. My son needs his waiver. He needs that care, and if he doesn't get it, it's going to create a much more reactive situation where he's going to be in mental distress and medical distress potentially. That's going to cost the state a lot more money. So it's just not a way to manage this needy population of Vermonters.
They got to stop cutting the services in mental health. I was first diagnosed with post-traumatic stress after my mother had passed away. And that's when I first was diagnosed with it. And ever since then, things went right downhill. And I'm here today to stand up for my rights and my advocacy and for my other peers at Evergreen that couldn't come today.
I've been a consumer at CRT for about 3 years. We have peer support programs. We have different programs that help mental illness people deal with daily living skills. Me personally, I suffer from post-traumatic stress. I suffer from severe mental illness, and without CRT, I probably wouldn't be here today. I'd probably be dead because I was very suicidal, and they basically picked me up off the street and helped me. And we've been cut. Our therapists and case managers haven't got raises for like 4 years, and I don't know why they stay except for they're dedicated, and we need to stop cutting us. We need to stop.
In the last 3 years, we've already seen $15 million go for services, and now it's going to be direct services. If this budget proposal passes and these cuts in fact go through, it's not going to be for case management, which is important enough. It's going to be for direct services. These folks who do the Way to Work program and they have jobs in the community, they're going to lose their jobs. One young man I just talked to just got an apartment because he got a job finally in the community. But if he doesn't have the support, the work support to go to the job that he has in the community, he's going to lose his job, which negatively impacts the economy, and he's going to lose his apartment. So there's another example. On the other end of the spectrum, my son's young, but we have tons of adults who work in the communities who get support to go to jobs and have independence. And again, that's something we're committed to in Vermont, right? We want folks integrated in the community. And that's all going to be taken away and slowly chipped away at if these funds keep getting depleted.
The rally lasted more than an hour. Politicians and advocates strongly urged the legislature not to make any more budget cuts and to keep pressure on their legislators. Ann Galloway, Vermont Digger, Montpelier.